I'm Lisa Martin. I'm a Southeast Asia correspondent with Agence France Press here in Bangkok. I'm also a board member of the Foreign Correspondents Club of Thailand, and I've lived here for 2 years. I am delighted to introduce to you our stellar panel lineup this afternoon. Dr. Buranin Rattanasombat is a Chief New Business and Infrastructure Officer at PTT, a Thai state-owned oil and gas company. He's also chairman on the board of Innobic Asia, a life science company focusing on pharmaceutical, medical technology and nutrition businesses. Sawadee ka. We also have Dr. Jos Vandelaer, the World Health Organization's representative to Thailand. Dr. Jos represented the WHO in Nepal. He also worked as a WHO Regional Director for Emergencies in Southeast Asia, as well as a stint with Médecins Sans Frontières, and he's a qualified doctor. Welcome. And finally, we have Kelvin Schmidt Sr., who is Vice President and Worldwide Leader, Government Affairs and Policy from the American multinational Johnson & Johnson. He's been with the company since 2005, and it's a welcome back to Thailand for you. You previously lived here, Kelvin. Thank you for joining us. Well, gentlemen, I'd like to hand over to Dr. Jos to start his opening remarks.
Thank you very much, Lisa. And first of all, I want to thank the organizers for inviting WHO to this panel. It's really a pleasure to be here. As opening remarks, just a few thoughts maybe. The pandemic has infected over 630 million people. Over 6.5 million people lost their lives because of COVID-19. And where we are now, it looks like the number of cases are certainly coming down. And in many countries, the measures that have been taken are also being relaxed. I think we see that everywhere, including in this country. However, at global level, we are still considering COVID-19 as a public health emergency of international concern. So I think that kind of sets the tone a little bit for what I wanted to say. Because we're talking here around rethinking healthcare after the pandemic, but is it after the pandemic? And so two questions actually come up. One is around what is going to happen with COVID-19? And the second question is, are we prepared for whatever comes next? And maybe I'll take a few minutes to talk a bit about that. On COVID-19, if you ask what's going to happen with COVID-19, actually nobody knows. We are currently in a phase of relaxation, if we want to put it that way, because the cases are coming down. But looking forward, one way of looking forward is to look at scenarios. What are the different scenarios that could potentially evolve? And in determining what scenarios, obviously there are a couple of factors, of variables that plays. The virus, if we go forward, how will the virus evolve? Will more virulent strains erupt? Will it become more or less transmissible, etc.? A second thing is around immunology. How well does our immune system hold up either after vaccination or after natural infection? How long will it last? How well will it hold up against any new strains? The third thing is around society. How will societies react to a new strain that may emerge? Are people tired of all the measures that are going on, or are people going to take it on again? And the fourth thing is, of course, medical. Are our diagnostics, our therapeutics, our vaccines going to be still working if a new variant or a new virus erupts? So if you take all these things together, you can come up with a couple of scenarios. And maybe you can break them down in four scenarios. One is a scenario where basically what we call optimistic scenario, where basically any future variants that are coming out are going to be less severe, less infectious, the protection that we have will last, and then basically it won't hurt us very much. That is one scenario that is potentially possible. Down the ladder there is another scenario which maybe we're in currently, which is we still have COVID around. COVID still makes victims, but it becomes manageable. That's what we kind of currently have. And that's maybe also currently the working scenarios that many governments have in mind looking forward. Further down the line is that we are going to see new variants that are, again, more virulent, more infectious, make more victims, and the vaccines or the immune systems that we have don't really hold up. So basically, we're going back to a certain level of that we have maybe, like say, with Delta or similar. And completely down the line is that we are going to see a virus erupt that is starting from scratch, where whatever we have in terms of immunity doesn't hold, whatever we have in terms of therapeutics, in terms of diagnostics, they don't work because it's a completely new virus or a new variant that is completely behaving differently. So these are kind of 4 scenarios that you can think of. And based on these scenarios, obviously we must look forward and start to get ready. We don't know which of these scenarios will play out. As I mentioned, currently we are thinking around a scenario of a manageable COVID-19, but we don't know if that will remain like that. Now, in terms of preparedness, how can we get prepared for the future? And preparedness, we need to talk about 2 levels. We need to talk about a global level, and we need to talk about country level. At global level, a lot of work has been done, and a number under WHO's auspices, a number of committees and groups have looked at what has the reaction of the world been to COVID-19, and what have we done well, and what could have been done better. At all levels, globally, regionally, at country level, at community level, etc. And at all aspects of the response. And there were some kind of 300 plus recommendations if you take all these different committees together. So if you take them together, from there, at the global level, work is now being done to think through around what can we further improve. And you can actually break it down in different areas. One is around governance, the global governance that we have. Is that still suitable for a new pandemic? Because there has been a lot of criticism around how at global level the pandemic was managed, how the tools that we have, like the international health regulations, are actually not fit for purpose in the case of COVID. So how can we improve the governance? A second is, how can we improve financing? And there is talk about a new global financing mechanism to finance the preparedness for a next pandemic. A third one is around systems. How can we improve the systems that we have at global level, but also at country level, to be better prepared? And then another idea is to have some kind of a new global treaty or a new global agreement for countries to better agree on what do we actually want in terms of exchanging information, in terms of what the WHO can and cannot do. How do we interact with each other in case there is a new pandemic? So these are things that are are being worked on at global level. At country level, there clearly what we have learned is, of course, things like governance, supplies, communication, surveillance, all these are important. But maybe the more important lesson is that countries that had a strong healthcare system were the ones best placed to react to COVID, to respond to COVID. And primary healthcare, the very first level of care, where everything comes together, where people actually first consult if something happens, is key in responding. That is one of the key lessons. And so there, countries are certainly advised to further invest in their healthcare system, and in particularly in primary healthcare, so that if a new pandemic occurs, that they can build on that stronger health system to make sure that the health workers are better prepared, that the supplies are in place, that the surveillance systems are there, etc. So in summary, I think we cannot say that the worst of the pandemic is over. I think we cannot say that. But at the same time, we have a number of lessons that we've learned, and we are at global level and country level, a lot of work is being done to be better prepared for whatever comes next. Thank you very much, Lisa.
Thank you for those insights. I'd now like to turn to Dr. Buranin for your opening remarks.
It is my pleasure to be here. Sharing is my experience for the rethinking the healthcare after the pandemic with a health expert from the WHO and the Johnson & Johnson. I think that everybody knows COVID-19 may be the one in the lifetime of the occurrence, but it had the less a global emergency and global concern and take an opportunity in the healthcare system. It created the remote work and cross-team collaboration between the international team and the local team and in terms of the public team and the private team. To handle the COVID, there is not just one solution. It's not just one team. We develop the multiple approach, multitask, multi-skill to deliver the solution, just like lockdown. And after that, we have got the vaccines. And after that, we the fast detecting. And also we develop the medicine to move the solution for the COVID-19. Nearly the 3 years, the pandemic scene never ending. It's continue to affect our lives, our economy, and our society. We don't know yet when the end be and the next pandemic will be occur. All of us should be prepared. Thailand ourselves, we try to prepare for the next pandemic. Thanks to WHO guidance, both general and specific, during the pandemic, we adapt in our health system. And also, Thailand has been ranked among one of the top healthcare systems in the world. We are able to handle the situation well. We plan to be a medical hub in the Southeast Asia with good doctor and hospital. But during the COVID, we found the room of improvements. First, we need to build resilient supply chain on both global and local level by diversifying and increasing the local production to ensure the supply security. Second, we think how to accelerate automation and innovation in healthcare, such as the vaccine, genetic, DNA, mRNA technology, diagnostics, telemedicine, or use the AI robotic for the healthcare and the big data analytics. And third, we need to building the health literacy, knowledge sharing, mass and target communication to gain understanding and transform the public. This is the way that Thailand and PTT do. And last, collaboration between the public and private sector, both local and international, is important. Not only the public sector is only responsible for the healthcare, but in the future, we think the private sector has a role to play as well. That's why we are trying to develop the life science business and life science ecosystem in Thailand with the advanced medical technology, with the international partnership and local partnership. I think this is the way we do for the next pandemic. Thank you very much.
Khop khun ka, Dr. Buranin. I'd now like to turn to Calvin for your opening comments.
Sure. Thank you, Lisa, and thanks to the APEC coordinators for what has been an outstanding day, and thank you to distinguished panel, Dr. Jos and Dr. Buranin. It is great to be back in Thailand, in Bangkok. มีความสุขมากๆนะครับ ผมอยู่ประเทศไทยประมาณ20 ปีก่อนนะครับ so very special to me. Look, some of what we've heard all day is all of this is collaboration between academics, public and private multinationals like Johnson & Johnson. What I thought I would do, and we'll have a great conversation, I think most importantly, is give you 4 or 5 key points that are really critical when it comes to healthcare. Learnings from the pandemic. Supply chain is number 1. Every element of it we are integrated globally, and to the extent supply chain across all borders is kept fluid. At the same time, you heard Dr. Jos say about resilient systems, critical for all economies across APAC. Number two, health data. Data interoperability, data between borders, the ability to innovate, sharing information in a timely manner, like pathogen strains is one great example. But finding a way to do that as we move forward is going to be critical for therapeutic development, as well as vaccine development across the world, and especially for the APAC economies. Number three, regulatory harmonization. One of the things that we know that with a transparent, robust, and digitized regulatory process, it will make all of the ability to innovate and collaborate much easier. Number four, we call it across the world workforce development, but when it comes to healthcare, the development of nurses, doctors, the frontline worker, leads to a robust healthcare system in each local country and economy across APAC. That is really important, and finding ways for physicians to make money at a local level, develop their skill sets, whether that's new clinical trial site development to practicing their craft. Very important to invest in development of the workforce when it comes to healthcare. So those are four really important takeaways from the pandemic, in addition to what my colleagues have said. But I'm going to hand it back to you, Lisa.
Thank you so much for those comments. Now, one common thread in all your contributions was the need to sort of boost resilience in healthcare systems and supply chains to cope with future emergencies. I'd really like to sort of expand on that a little. We know that the medical supply shortages were crippling during the pandemic, and even countries with advanced healthcare systems were overwhelmed at times. What specific lessons do we need to take to prepare for the future? Can you give some ideas of what really we need to keep in mind should we face, I don't know, the next COVID? Let's start with you, Dr. Jos.
Yeah, thank you very much. Clearly, as you mentioned, and as Calvin also mentioned, supply has been a major issue. And partially that was because everybody wanted the same things at the same time. And what we saw was a kind of come first, serve first kind of attitude, or a nationalism, or whatever way you want to put it. And that led to huge inequities, that some countries or some economies managed to get hold of certain commodities while others didn't. And that is clearly an issue. There is the amount of supplies, there is the supply chain, and then there is the distribution, which also needs to be equitable. So I think one of the things that we have learned is that is a potential major bottleneck, as Calvin also mentioned. What has happened during COVID, and it worked to a certain extent, but at global level, different partners came together, WHO, but also Gavi, the Global Fund, industry, governments, under the ACT Accelerator. Which was an initiative where there was an attempt to collaborate with basically everybody involved in the COVID response to coordinate research, to coordinate production, to coordinate supplies, and to do it as much as possible in an equitable way. And I think, as I said, the COVAX is probably the most well-known of this, but it also applied not just for vaccines, it also applied to diagnostics, it also applied to therapeutics and so on. And that work is still going on. And there's our efforts now to make this more permanent as part of preparation for whatever may come in the future. So collaboration, again, as Calvin said, is key, and I think this ACT Accelerator is one example of how this can be done, and clearly we need to do more of it. I'm not saying that ACT A was the solution for COVID, clearly it wasn't. But this kind of collaboration and coordination is certainly one way of doing it. Again, talking about supplies, additional production points may also be something that may help local production. And I think colleagues here probably know much more about it than I do, but you also have then to think about intellectual property, about quality assurances, etc. But certainly looking at how the production can be scaled up of vaccines or of other commodities in very short time is certainly also very important. But what we shouldn't forget either is that it's not just a supply issue. As I mentioned also in my opening remarks, we need to also look at how can we do things better by working together. Not just in supply, certainly in supply, but also over and above that. The data exchange that Calvin mentioned is key. But how do we do that? Under the current regulations, there are all kinds of restrictions. And countries need to, or economies need to agree before their data are being shared. Can we change that, for example? That's one example. And currently, at global level, discussions are ongoing between member states, WHO member states, to see how far countries want to go in changing, for example, that. Similarly, the way that WHO can further investigate certain things that are happening. Also, that is on the table for discussion. So there are a number of things that are on the table to actually have a stronger system at global level, so that if a next pandemic happens, we don't get entangled in all kinds of regulations that actually limit us. I mean the global health community, limit us in how we respond.
Kelvin, would you like to weigh in?
Sure, just to add a couple points to what Dr. Jos has already well articulated from experience. And I can tell you, we were talking earlier, for 24 hours a day, 7 days a week during the pandemic, I personally spent time on this issue. Health authorities across the APEC economies working together is essential. And what we learned is how intermixed the regulatory body and the local economy are. Really critical. So from the FDA to EMA to the health authorities in Asia Pacific, really important that there is sharing of information, whether that's pathogen sharing, data information in terms of health data, for whether it's clinical trials or distribution of the end product. And then the democratization of the supply chain at the lowest convertible item. So for example, when it comes to vaccines, the filling of a vaccine is easier tech transfer than, say, the drug substance in biologics manufacturing. So you can quickly get to filling capacity in the Asia Pacific economies much faster. So those are a couple lessons learned, and having some warm capacity so that way countries don't take a mercantilistic approach is also really important, because then it doesn't make a country around the world try to close the borders and protect just the country itself if you know that there's warm capacity for therapeutics and vaccines. Back to you, Lisa.
It seemed like it was every country for themselves in the scramble for medical supplies and vaccines. I'd like to invite you, Dr. Buranin, to comment on Thailand's experience and the lessons that Thailand can take from COVID.
Yes, thank Lisa. For my opinion, I think the resilient the supply chain is the part of the health security. And we think about the health security right now is very important for the pandemic. We should every country should be lift up the health security is the national security. This is very important. For my opinion, when we talk about the health security, it doesn't mean only the availability. It should be take care about the affordability, because when we talk about the developing country, we are the follower, we are not the leader, and sometimes we need is the one part of the global supply chain. And why we think about Thailand should be develop the life science company, and we think about Thailand should be increase the more capability in terms of the production, in terms of the some warehouse to do this. And also we think about the supply chain is the part of the risk management. We think about we cannot do this by alone. We need to work with the international company and international agency for our opinions. And also in Thailand, for during the COVID, we can acquire more vaccines from every sort of the vaccine to serve our people. I think we are resilient in terms of the supply chain in the healthcare.
I want to go back to a point that both Kelvin and Josh raised earlier about the importance of data. Some analysts say that the health sector really is yet to take advantage of the full potential of big data, unlike banking and retail. I know that Denmark is a bit of a world leader in this space in terms of patient digital health records, and the EU is about to embark on a massive health data space project with cross-border coordination and huge potential benefits for medical research and policy makers. I'd just like you all to reflect on how did data assist in COVID responses, and do you see digital medical data as a big game changer for future health emergencies? And do we have to sort of get the balance right in terms of issues of patient confidentiality and privacy protections, as well as hacking threats? Let's start with you, Kelvin.
Sure, thank you. It's a big topic and complex. And so what I would tell you is, and my colleagues from Google and Amazon and big tech companies would concur, that today, all the data in the world, about almost 40% of it is health data. The issue is it's underutilized and not mined, and there's a lot of, as you mentioned, issues with it. So the opportunity is to, one, focus on the patient, knowing that every country has different regulatory processes for the utilization of data, and we have to ultimately respect a patient's privacy. At the same time, there are regulatory processes to have in place for de-identified or anonymous data that can be really useful when it comes to clinical trial development cross borders to speed up the ability to innovate new therapeutics, innovate new medical technology, allow patients to enroll in clinical trials. It is essential for all public health. The other thing it can allow for is predictability, prediction of what's coming. It could be either a new virus, a medical unmet need, a disease that is yet not determined or predicted. So that's some of the benefits of mining and harmonizing health data. However, we also recognize that there's many cultural and regulatory issues that exist around the world. If we all recognize that it's part of the APEC economy's best interest to figure out a way to navigate and thread the needle of how to leverage health data, we will be able to, in partnership, in collaboration, innovate much faster for the benefit of public health.
I think when we talk about the data, it's like two sides of coin. As a one side, the data is very useful for the doctor, and data is very useful for the monitor and follower. And another side, if you have the more the privacy data, sometimes they affect the patient, and sometimes they affect about the trust and confidence. We think about for this issue, we should be handle the data with care, and data should be the progress for the monitor and the support and the control the pandemic. I think this is very important. But in the future, we need from the historical data to predict the future, and we need a lot of data to do to develop the new drug formula and something like that. And I think that one thing is very important. Thailand should be we are the part of the clinical trial for the medicine. I think it's my opinion.
Dr. Jos, there's often a huge gap between the official statistics of COVID case numbers and the real case numbers on the ground. Does the WHO sort of see opportunities in terms of big data in the future?
So maybe first I should say that in health and in public health, data have always been one of the pillars of a health system and of any public health program. Sometimes to the general public that's not always visible. People maybe are familiar with their own private or personal patient records, but there is happening much more behind the scenes. Even in the poorest country, in the most remote health center, if you go there, you will find records of the number of people getting vaccines or the number of people who consulted, etc. And these numbers are being collected and are being aggregated, etc. So that we do have data around what proportion of children are vaccinated for measles by district, etc., etc. So that's just as an example that in health and in public health, data are very important and have always been. In COVID, certainly data have been important. Calvin mentioned clinical trials, and clearly that is the case. But of course, also data have been very important to understand where the virus was, how quickly the virus was spreading, what kind of patients were more susceptible, what kind of patients were more easy or were more at risk when they were hospitalized. These are all types of data that were very important for us as a global health community to understand what we were dealing with. I think where we are sitting today, maybe we forget where we were in the beginning of 2020, but in the beginning of 2020, we did not know what we were dealing with. We did not know whether that virus, if you were catching it in March 2020, whether you were going to die or not. We simply didn't know. We didn't know what the treatment was. Doctors didn't know how to treat it. There was no vaccine. We did not know whether masks were helping or not. By collecting all these data around what was happening, it helped us again, the global health, public health community, to better understand what we were dealing with, what this virus was and maybe what it wasn't. And certainly clinical trials were part of that, but also what protected us, how was this virus being transmitted, etc., etc. That was all data-based. So data extremely important in normal circumstances, in peacetime, to call it that way, but also during the pandemic. Now, of course, like with all the data, the reliability varies. It's not always what you see is what is really happening, for a number of reasons. I think we don't need to go into the details of that. And digitalization is kind of one way of making these data better accessible. as I mentioned, in all the health centers worldwide, data are being collected. Very often that is still in paper form. You go into a health post, you will have registers, paper registers where people tally things, etc. Clearly, if you want to act quicker, if you want to have faster access to your data, if you want to better analyze your data, having data in a digital form is of course much better, and that's certainly the way to go. And that is something that the WHO is working on with member states to upgrade their data collection systems and in a way that is more digital, and also in a way that helps them to better analyze data. Also in COVID, it turned out that it was very important for the decision makers to have access to data, because a lot of the measures that were being implemented had to be based on what we knew at that time about the epidemic. So again, importance of data for decision makers, very, very important. You mentioned also issues about confidentiality and so on. Yes, that's certainly an issue with health-related data always. But as Calvin already mentioned, you don't always need to bring the data back to an individual. You can anonymize data and still use them and aggregate them, etc., and analyze them. So that is certainly one way of doing it. Will the data always be safe? I think the answer is no. We see hacks in all kinds of databases, but let's hope that the progress that's being made in protection stays ahead of the progress being made by the hackers. So, but clearly, yes, confidentiality is always an issue.
I'd like to shift gears now to another global emergency that the world is facing. Are there lessons from the COVID pandemic that the health sector can use when dealing with the ever-increasing instances of natural disasters? We know that climate change is increasing the frequency and intensity of extreme weather events. Hurricane Maria in 2017 hit Puerto Rico as a Category 4 storm, disrupting the pharmaceutical supply chain. And that had serious consequences for the American healthcare system. How important is diversification of the medical supply manufacturing industry?
Very hard topic when we talk about COVID-19 or the pandemic. It's like the natural disaster, because the disaster is come every year, and maybe they have in 1 month they have in the month they have the value fluctuate and volatile. Is our experience. We come from the energy company. We know when we deal with the volatile, we need to integrate the on-off the supply chain and integrate the on-off data and make decision with the fact base. This is our key to handle the supply chain. And second, we need to build up some idle capacity. Sometimes we need to stock the vaccine. Sometimes we need to invest in the innovation with the some company. This is a very important. Even this is a cost, but compare with the life, compare with the health, I think sometimes we need to trade off between the cost and health. I think this is very important. If we cannot secure the health security, we can keep the economic, and we cannot keep the economic, and we cannot keep the society. This is my point of view.
Thailand obviously has a lot of flooding. Kelvin, let's go to you on this topic.
Sure. Look, the purpose of APEC is collaboration, public, private, academia, and as the largest healthcare company in the world, we recognize that governments and countries are going to want to try to protect the population of their country and want to have healthcare services and products domestically sourced. So we empathize with that. At the same time, the supply chains around the world for healthcare are inextricably linked. And it would take years to decouple the global supply chain. And so it is really, really important. And one of our biggest learnings of the pandemic is, as the Honorable Thai Prime Minister said this morning, being very open and collaborative and keeping supply chains, whether it's as simple as medical products to cross borders to what actually goes into making a therapeutic. It is complicated. The safety of patients is critical, and the more open we can be across the Asia-Pacific economies to accomplish that goal, the better off we will be. And that really goes in non-hurricane times as well as hurricane times. So back to you, Lisa.
Dr. Josh, your thoughts? Obviously, this would be a topic that the WHO is very concerned about, the increasing numbers of extreme weather events and how that affects public health.
Yes, certainly. And so far we have basically been talking about the pandemic, which is an infectious disease emergency. But yes, there are natural disasters. There are all kinds of disasters that can happen. And that do happen, and that continue to happen even during the pandemic. And I think the answer, your question is maybe specifically about supply chain, but it's actually a broader question. Supply chain is one element, and often the most visible element, because if people need certain supplies and they don't get them, that is very, very visible. But there are, of course, other aspects to responding to a disaster. It has to do with human resources, it has to do with communication, it has to do with management, with governance, with surveillance data, and so on. All these things actually need to be in place if we want to have a good response to an emergency, be it a natural disaster or more an infectious disease emergency or whichever. All these things need to be in place. And I think what COVID has brought to the forefront is that more work needs to be done around preparedness. And I already mentioned earlier the work that's being done at global level, that's going on. That will certainly not only apply for a future pandemic, but will also apply to natural disasters. It has to do with exchanging of information around, it has to do with travel of people, etc., etc. So that is certainly important, but also very important is at country level, that the health workers, the hospitals, the health system is prepared. Not just for an infectious disease emergency, but also for a natural disaster. I worked before in Nepal before I came here, and I arrived there right after the 2015 earthquake. Although I wasn't part of the immediate response, in the years after the earthquake, we worked very hard with the government on the preparedness for the next one, because another earthquake was predicted. We don't know when that would come, but another earthquake is predicted. So we worked very hard with setting up a system of working with hospitals with a referral system, that if patients would come, that it would be clear who could be treated where and who needed to be referred. We set up stockpiles of certain commodities, drugs, supplies, even buckets, etc., that may be needed. We worked with them on communication systems. If the normal communication systems would be down, with radios, etc. And all these things is basically ongoing work that needs to be rehearsed regularly. It is so that people know what to do if an emergency happens. And with more natural disasters coming up, I think that will become all the more important and all the more urgent. So in a nutshell, it comes down to preparedness, supplies being part of it. And what we shouldn't forget when we talk about all this are the inequities. Countries that have more means will be better prepared. Countries that have less means will probably focus more on the day-to-day needs and less on preparedness for a bigger disaster later on. Again, that's where collaboration can come in. That's where working with neighboring countries, with the global community can help. So, and then the other thing which I haven't talked about yet is that when we talk about emergencies, it's very often not just a health issue. It involves ministries that are responsible for law and order. It involves ministries that are responsible for infrastructure, for housing, etc., etc. Multi-sectorial collaboration is also very, very important. And very often it's maybe not the health sector that needs to take the lead, but maybe the Ministry of Interior needs to take the lead in a natural emergency, where health is only part of it. But there are other needs. People need to get their food. People need to get water, need sanitation, etc. So we need to work within the health sector, but we also need to work across sectors so that any response is coordinated. And we also on the preparedness, we need to do the same thing.
I'd like to talk about public trust in the health sector now. At Agence France Presse, we have a fact-checking division that has literally debunked hundreds of nonsense, misinformation and disinformation posts on social media about COVID and COVID vaccines, ranging from putting lemon drops up your nose to onion tonics to cure COVID. I want to go back to you, Dr. Jos. I'm interested to hear about how the World Health Organization has grappled with this trend. How do we restore and maintain public trust in the healthcare sector?
Indeed, there has been a lot of misinformation, and we see misinformation not just on COVID, but we see misinformation, more and more misinformation on quite a number of things. Many politicians can tell you the same thing on other topics, but it seems that it becomes almost part and parcel of our life, miscommunication. So how do you tackle it? I think you tackle it with facts, you tackle it with science, and underlying there is trust. I think to counter this misinformation, it's important that what information you give, the right information, the scientific information, is based on science as much as possible, because sometimes we don't really know the science, and then we have to say we don't know it. You can't start speculating. But because trust, people need to know who they can trust, and I think that is the main approach that needs to be taken in communication. What WHO has done is take that principle, communicate around what is known, what is not known, and try to build a brand of trust that people felt there's no hidden agendas here. This is what the science says, and at the same time worked with networks, also with communities, going down all the way to communities to reinforce these messages. What we are seeing is that very often people believe people closest to them. And so working through the Ministries of Health, or the Ministries of Health, working through community health workers, for example, has shown in COVID to be a very strong factor of getting messages across down to the communities, because that are messages that are basically being then transmitted by people's neighbors, who have a link with the health system and can relay more correct information. So for WHO, that's kind of the way it was approached, and I think that's also what most of the governments have tried to do.
Kelvin, I'm interested in the private sector's sort of role in boosting public health awareness. Do you sort of see a need for an adjustment in communication strategies and perhaps simpler language?
Sure. So one thing, I just want to piggyback off of what Dr. Jos said. Trust is the key word. And in institutions of government and large enterprise, trust is generally low for the general public. And so to use a Thai phrase, rapi chop, it is everybody's responsibility to stick to the facts and the science. And you heard the chairwoman in the previous panel talk about faith. You have to have faith in the facts and the science. Philosophically, we all have to assume that in the social media world and the digital world we all live in, how to navigate fact from fiction, that is all of our responsibilities, and you can get very philosophical that we have to teach and train from cradle to grave the ability to navigate. The private sector does have a responsibility, so as an example, mandating vaccinations for all if you want to have a condition of employment. That puts some mandating and trust and money where your mouth is on the importance and belief in something like a vaccine, as an example. So I think we all are in this one together. I think the APEC economies, if there's one thing around collaboration, it's how do you build trust as governments and private institutions to stick to and believe in the science, because that's really what it comes down to. And as a company that only focuses on patients and in the stakeholder world that we live in, the science usually wins. We follow the science.
Dr. Buranin, what are your thoughts on this? Obviously, Facebook and Twitter are very popular in Thailand, and people are getting information from their friends. How important is it that the Thai government and private companies make sure that they are promoting good health messages?
I think Thailand is a land of the social media. We open for every platform for the social media. But for the health communication, I think the health communication is very important. In the beginning of the COVID, they have a lot of the fake news and the marketing conversation about the product, because I think everybody don't know about the COVID. And after that, when the time is passed, we can gain more understanding from the Ministry of Health, from the WHO, or from the pharmaceutical company. They prove by the scientists and prove by the bedside to educate and introduce and create the more health literacy and the more awareness. I think for the communication, it should be make easier and sincere conversation. This is very important, because I think that everybody they think about, they are worried about health, they are worried about the economic, they are worried about the society, because when the mother and father got the COVID, they are worried about the son and the daughter. And we think about the communication should be, they have the formal communication. It is the first to direct conversation to the public. And second, we need to use the easy language to make everybody understanding. And the last, we think about the sincere speaking. Sometimes we change the word for the political message. They hurt the health system. This is my idea for the conversation and communication during the COVID.
Unfortunately, we're almost running out of time, but I'd like to just go back to all our panelists for for one sort of final observation before we let you find people go and enjoy your dinner. Let's start with you, Dr. Josh.
Final observation. I think first is we're not out of the woods yet. I think we have to remain vigilant, and we have to work together, collaborate across economies, across sectors, to get better prepared for whatever else is going to come in the future. I think that would be kind of my closing remarks. Thanks.
And Kelvin.
Here's what I would say is every single person in this room knows someone that was affected by COVID, family, friend, colleague. So my last word is healthcare is very personal. And if you go back to the theme of what APEC stands for, because it's so personal, it affects all of us. It affects economies, it affects how we work, it affects our ability for commerce, it affects everything. Mom, dad, husband, wife, partner, child. It's very personal. That's number one. Number two, Binajagan, T America, APEC. See you next year at APEC in the United States. And I want to just finish where I started. Thank you to all the APEC coordinators. And just remember, collaboration is key to innovate. And as the Prime Minister said, to have a prosperous economy, we must have a really resilient global healthcare system. So thank you.
And Dr. Buranin.
I think it's a hope, courage, and new beginning are key keywords to rethinking about the healthcare system. I believe in the power of the human. We try to bring the hope and we courage to develop the vaccine, and we think about after COVID is the new beginning of the healthcare system of the world. Thank you very much.
Ladies and gentlemen, that brings our panel discussion to a conclusion. Thank you very much for your attention. I know you've been sitting down all day, being talked at, and you're probably very, very hungry. Please give our panelists a round of applause. Thank you very muus, Dr. Buranin Rattanasombat from PTT and Innobic Asia, Kelvin Schmidt from Johnson & Johnson, and of course, Jos Vandelaer from the World Health Organization. I've been Lisa Martin. Thank you, Khop Khun Ka, and good night.